liver cirrhosis. It is a chronic inflammatory, life-threatening disease of the liver in which the liver is converted into the fibrous tissues and the liver become shriveled up, stiff and stony hard, because the normal parenchyma of the liver, which consists of connective tissues and hepatocyte along with the vessels, blood vessels, portal vein, blood vessels and the bile ducts. These are all tubular structure within the liver parenchyma. Due to the invasion of the foreign bodies or the factors which attack the liver tissues, the immune system of the body come into action against that factors, and there is battle between the invaders and the attacker or the defender ones. If the invasion of the pathogens or the other factors, they are vigorous and powerful, the immune system is unable to kick them out. As a result, there is a chronic inflammatory damage to the liver parenchyma. Liver is a largest gland in the human body and it has a multi-function. That is metabolic functions of the body, production of protein, albumin, clotting factors, biles, and also it has the main detoxification duty in the body. The various toxins and the drugs, they are excreted and they are metabolized and detoxified and excreted via the kidneys. So when the normal functioning of the liver, they are destroyed, the liver becomes functionless, it is stony hard, and this condition is a chronic one, that is after several decades the final stage of the destruction and is called as cirrhosis of the liver, and this stage is irreversible, cannot be treated one except the surgical intervention, that is the total liver transplantation. The pathogenesis is the various factors. The foremost factor is excessive use of alcohol. Then the prolonged attack of viruses, that is hepatitis B and C. Then fatty liver, non-alcoholic steatohepatitis, hemochromatosis, Wilson disease, genetic predispositions. These are the main factors, especially the alcoholic destruction of the hepatocytes. These factors, they destroy the normal structure of the liver, that is hepatocytes become dead due to the process of necrosis, and the normal connective tissues which make the function or the structure of the liver, that is, they are just like rubber one, soft one, and they are replaced by the fibrous tissues. The liver size is short and shrunken and shriveled up, and it is stony hard. Due to this fibrosis, the fibrotic material put pressure over the vessels within the liver, that is the portal vein and the blood ducts, bile ducts and the blood vessels, due to which there is decreased supply of oxygen and nutrition to the normal tissue of the liver. Initially, in the first stage, it can be reversible, it can be managed and treated when the disease is at the initial stages, because some quantity of stem cells are present in the liver parenchyma. In the case of initial destruction, or attack of the factors which destroying the function of the liver, they regenerate. They are converted into the hepatocyte to maintain the functions of the liver. But if the etiological factors, they are overpowered, so this regeneration process is impeded or is stopped due to the invasion of the etiological factors. So this initial regeneration in the form of nodules, that is called as regenerative nodules. But it depends upon the severity of the etiological factors. Prolonged intake of alcohol, prolonged action of the hepatitis B and C viruses, excessive deposition of copper and iron within the cells of the liver, and the obesity or the fatty infiltration of the hepatic cells. These factors, they are the main etiological basis for the destruction of the normal cells of the liver, and the liver is converted into a fibrotic ball, and which is in the last stages become functionless, that is the liver failure, which is we call fibrotic liver, which needs to be replaced by the surgical intervention.